Hello and welcome to my channel. I am Dr. M.D.Zafar and I deliver lectures on the core concepts related to the IMM surgery and allied for FCPS and MS candidates. Today we are going to talk about wound healing, phases and different timelines. So before getting started, I have arranged these wound healing phases in terms of their reference days and weeks in the form of a table. We have a better understanding. So first of all, we have the inflammatory phase. Inflammatory phase, or known as the lag phase, starts at the second and it ends at the third day. But you can also be provided with a range between 1 to 4 days in reference with the inflammatory phase as well. Next phase is the proliferative phase. It is from the 3rd to 21st day, or it can be asked in the form of 3 days to 3 weeks. Then we have the remodeling or the maturation phase. It lasts between the 3rd week to 3 months, and it can sometimes be asked in terms of years. In that, you can use for 1 year. Now, the next statement can be asked that when does the immediate maximum tensile strength is achieved by a wound? And the answer would be 13th to 17th day. Now, another question going to be asked that what is the overall maximum tensile strength? And that would be at the 12th week. Then they can ask you that what is the maximum collagen content present in a wound, like which week or which date. In that, you will have to choose 17 to 21 days. Another reference days could be from 2nd to 3rd week. Fibroblast. Regarding fibroblast, they can ask you that fibroblasts gets to their maximum at the 5th day. Now, fibroblasts are the cells which are responsible for laying down the collagen. Collagen is one of the most important building blocks for the wound healing process. So, we'll talk about this in a short while. Then, re-epithelialization. It is computed in 48 hours. So, primary closure is done within 6 hours. They can ask you that what is the time limit for the primary closure. And they can also ask you that tensile strength of a healed wound only reaches 80% of its original. It never reaches to complete strength after any sort of injury. Now we will talk about the principles of wound healing. Wound healing is a complex biological process that restores tissue integrity after any sort of injury. It occurs in 4 overlapping phases, and there are certain factors which will be influencing this wound healing. First of all, we will talk about different phases of wound healing. So first of all, we have the lag phase. As I have explained, it lasts between 2 to 3 days. It is the very first phase. In some text, it is referred to as the inflammatory phase. Now in the lag phase, the most important first step is the vasoconstriction of the blood vessels, which will result into a thrombus formation. Now this will be followed by the proliferative phase. Proliferative phase is between 3rd to 21 days. Now the very important point is that in the second half, at the start of the second half of the proliferative phase, there will be a start of deposition of collagen by the fibroblast. Now, fibroblasts are the cells which will be laying down the collagen, and the collagen which will be laid down initially will be type 3 collagen. Later on, this laying down of collagen will progress in the 3rd phase, which is the remodeling phase. The remodeling phase is from 3 weeks to 3 months. Now, the collagen is ideally present between 2nd to 4th week. Later on, at the later end of the remodeling phase, this type 3 collagen will be replaced by type 1 collagen until we achieve a 4:1 value of type 3 and type 1. So in the first step of the wound healing, we have hemostasis. As I have explained, vasoconstriction occurs followed by platelet aggregation. There will be a formation of a clot to stop the bleeding. Now, there is also release of certain cytokines and growth factors, out of which platelet-derived growth factor and tissue growth factor beta are very important. After this, we have inflammatory phase. In this phase, neutrophils and macrophages will start to clear the debris and bacteria, and cytokines will start to attract fibroblasts. Fibroblasts are the key role players which are going to deposit collagen. Now in the proliferative phase, there is going to be migration of the fibroblasts and they are going to lay down type 3 collagen. So collagen type 3 is initially present in the proliferative phase. It is produced by the fibroblast. So anything can be asked in the form of an MCQ. This is followed by angiogenesis, epithelialization and granulation tissue formation. So there is an important point that the initial tissue which is laid down in the proliferative phase is known as the granulation tissue. After this, wound contraction will be done by the myofibroblast. Then we will be having the remodeling phase. In remodeling phase, the important point to note is that the collagen type 3 is replaced by collagen type 1. Collagen type 1 is going to provide the tensile strength which is required for wound healing. It will be followed by scar formation as well. So now we will talk about the principles which are required for optimum wound healing. First of all, we have the aseptic technique. It will prevent any sort of infection. Then adequate hemostasis. This will reduce the formation of hematoma and further reduce the risk of infection. Followed by adequate debridement, that is removal of any necrotic tissue or foreign material. Then a moist wound environment will promote the migration of the cells and new blood vessels. Approximation of the wound edges. The better they are approximated, the minimum tension will be there on the surgical edges. As a result, there will be better wound healing. It is important to minimize the dead space as it will prevent the hematoma or seroma formation. In terms of nutritional support, vitamin C and zinc are the cofactors which are required by the fibroblast to lay down collagen. So they are very important. Then we have the infection control that can be done by the use of antibiotics wherever they are indicated, and regular dressing under sterile conditions can be helpful to promote optimum healing. So now we will talk about the factors which can affect healing. We have local factors as well as the systemic factors. Among the local factors, infection, poor blood supply, foreign body and excessive tension would be the key role players. Whereas in systemic factors, diabetes, malnutrition, steroid use, smoking and immunocompression can result into failure of optimum wound healing. Now in order to understand or tackle the MCQs, what could be asked? They can ask you that which factor is most likely to cause delayed wound healing. So if you can find infection, then it is the best option to choose. However, sometimes the infection option is not present. Then the second best option to choose would be foreign body. So at the end, we will talk about the different types of wound healings. We have primary healing, secondary healing, as well as tertiary healing. In primary intention healing, the wound edges are perfectly approximated with the help of sutures, whereas in secondary intention, wound is left open and it deals by formation of granulation tissue and by means of contraction, which is done by the myofibroblasts. Then we have the tertiary intention. In this, primary closure is achieved after infection has been controlled. So regarding certain MCQ points, if they say that there is a clean wound which has approximated edges, it will heal by primary intention. And in primary intention, there is minimum scarring. However, if the wound is contaminated or it has certain gaps between the edges, then it will heal by secondary intention and it will result into formation of large scar mark. So thank you very much for listening. I hope I have cleared your concept regarding wound healing.